If y'all want, this could be like a Q&A session because we have like 40 minutes. Totally up to you. But I do understand that we already went overboard. So please mute your mics. So we continue. So if it is that you use any bay leaves to preserve it, um you might have to list it as an ingredient if it is that you have it in like a tea mix or something like that. Bay leaf in your everyday life, that's absolutely fine. You know, it's only when it gets to the point of having to do it as a product, you made that executive decision on what you want to do. Any more questions or anything that you want me
Miss,
to?
excuse, did you share your TikTok with us on the chat?
No, not yet. I would send that to you guys afterward. Yeah. I will
Okay,
link
thanks.
two videos. I think one of the videos was herbal oil, and I actually had used a fresh rosemary in it, and it actually spoiled. But it was just like a demonstration on how to do the herbal oils. Yeah. And then the next one I wanted to show you guys was the easy infusion one, the easy brew infusion one. Yeah. To me, that's like the best and the easiest thing is, like I said, is very versatile. Um, it's a like I said, it's also expensive. I'm not sure if the price increased from the 289 because I bought it several years ago. So really, it depends on what you want.
Also, Miss, how would we know what herb is best used and for which method? Like to make tinctures or to do it oil or water? How would we know?
Okay, so in terms of like the type of herb or like is it fresh versus dried?
No, whatever herb. We can use
Okay,
any herb in
yes,
anything or
you can
the
use any herb.
exemptions.
You can use any herbs. However, when you go through the document, you'll see that tinctures are usually more for. So you need to make a decision based on what you want. So, for example, if you know you don't want alcohol, then tinctures and vinegars is not really for you because vinegar is more on the very strong alcoholic side as well. Because if it ferments to the point that it turns into alcohol, you don't want that to happen. So it really comes down to what it is that you want to use because you don't need to use a tincture if you have a glycerite and you want to use glycerin for your kids. Now, most herbs can be used for herbal preparations. Only if so, this is why I had people do a materia medica and a herbal monograph, which is a document that gets you to know the herb very intimately, and when you do your research, they will tell you, okay, this is the type of preparations that you can do with it. So, for example, marshmallow is a very sensitive plant. You don't want to use. We don't have it in Trinidad, but I'm just using it as an example because it's a very sensitive plant, and usually you will use room temperature water with the marshmallow to do infusions. You don't really use anything cold or you don't use any hot um or water for it because you don't want something to have to shock the plant. So in that case, you need to know the type of plant that you're using. If it's dry, then it really doesn't matter. But if it is fresh and you harvested yourself, sorry about that. That's my cats. Um, yeah, if you have a it yourself, then you need to know the plant and then you need to know what you're gonna do with it.
Excuse me, does wormwood grow here?
Mm, I'm not sure. I don't know it, but if it's a plant that can be grown in a tropical region, yeah,
If it grown in Florida, then it could probably grow here.
you can try it. But you have to make sure that the seed that you're planting, you need to make sure that the soil is going to support the growth of the plant and that you're not going to like neglect the plant and assume that it will grow because a lot of people do that. But you need to maintain the environment or the soil for the plant to grow properly.
Okay.
So for example, rosemary grows in very sandy, dry soil. However, some people still put it in an area where it gets wet a lot. It's a very muddy soil, it's not very sandy soil. So then they wonder like, why isn't my rosemary growing? And once you get your rosemary to grow, it literally propagates like into this huge bush, you know. So knowing, but this I won't cover, plants and stuff, but knowing the environment that your plant needs to be in plays a huge role in what is can be grown here in Trinidad. And a lot of people on large scale, they use greenhouses, and greenhouses, they control the temperature, the environment of the plant, so that way it can best support the growth of the plants in a healthy manner. Any more questions?
Miss, where do you get your herbs from that we want that not grown here in Trinidad?
Okay, so I get mine from Almighty. She, if it is I want something, I really don't want to go through the whole getting a broker and importing things, because they already import for their own business. So if you want something, I think it's a minimum of £5, they would buy it for you, and you just pay them for it, the wholesale amount. Yeah. So I usually
Okay,
go
thanks.
through that. Simply because I don't really want the hassle of having to shop around and source it, buying it from an external source. It really takes a lot out of what I want to do in terms of my personal life, my what services I want to offer. So it really I trust her and her business, and I think she had like a tea shop and stuff before. So I just get it from her, because really, if you have to research it, find out who your suppliers are gonna be, how long it's gonna take, clear it with customs. It's a lot of work, and it's very time consuming. So by getting it, yeah. Okay, any more questions?
Miss, I must start bringing herbs to sell.
That's the issue. Like I could, but it's a lot of work. It's a lot, and I'm just one person.
Because I find I don't have enough herbal stores in Trinidad,
Mm-hmm.
and you're learning about different herbs, but when you try to get it, it's always you have to import it, you have to import it. And to import herbs, sometimes it's difficult because I was told that I think you have to have a specific license sometimes to bring in these
Yep,
herbs.
definitely. So that's why I would just buy it from somebody else instead of actually doing it myself, because licenses you have to pay for. I am just one person. I'm a very small player in the game. Most of my service is geared towards education and people understanding the products and how to make it themselves. I only actually do have the shop part simply because of the convenience, that people were like, okay, how about you just sell this? And I'm like, okay.
No, the
But
reason why I said the reason why I recommend it is because of the fact that you're teaching the class, you will
mhm.
have a more awareness of the different types of herbs. And when you teach the class, you could afford to sell the class, everybody that you come in contact with via your classroom. You could
Mhm.
afford to advertise your herbal business now to show that here what if when you need the herbs, you can get it.
Okay, I understand. It
Just as
only
how
take
you're
a
doing,
little
just as how you just sell like the different tinctures and stuff, you could
time.
also sell the herbs to do that in that aspect because um you already have a class and you already have a flat platform where you can advertise. Some for me, I am trying to find dandelions for the longest while. And to every herbal store I go in, I cannot get, for the love of God, these dandelions, flowers, or seeds, or anything. So it's really, really difficult. And then a lot of the herbs now that you're getting in tutus, if you don't put it in the fridge, they get in these bugs.
Yeah, definitely.
Cindy, excuse.
Yes,
I
my dear.
understand what you're trying to tell Miss, right? But from what Miss had explained earlier on, putting together the material for each class is a lot of work, and it's just one person. Now, it would be great if she could have got this side of the business up and running, because it would eliminate the students from having to search all over. Okay, Miss have it, we'll just order it, £5, what, £10, whatever we want from her. But like from what she explained, I think it's a bit much on her plate right now, together with her school that she's doing and stuff.
Okay.
I would take it under consideration because, like I said, I mean, I don't want to put you guys at a disadvantage to do any courses and get any material to thing. So I'd have to look into expanding my team. So I will definitely take it under consideration. Don't worry. Because I know the convenience is such a huge, factor as well for people who work in and have other things to be doing. So yeah. Any other questions? Anything you want me to touch on?
For me, no. I can't wait for the other classes to come.
Miss, how long will the class run until?
So it's actually 10 sessions. How it's
Great.
set to be is that every month is going to be a session. I try to make the sessions as independent as possible so that way you can just do the session, you can join back in. Now, so for example, when I did the apothecary setup, when I did the introduction course, it can run independently, but it means that I'm going to have to explain a little longer in the other classes if I'm talking about why are we using amber colored glass, why are we using glass, why are we not using plastic, why are we using certain materials. Now, the first session covers all of that, the apothecary materials, how you're going to do your research. It has a template for doing your materia medica and the herbal monograph because one way of knowing your herbs is to be intimate with it. And the assignment for that last session was that people were supposed to get to know the herbs, taste it, boil it, make it into a tea, eat it raw, eat it dried, cook it in food, like figure out, try to say, okay, what does it taste like? What does it smell like? Is this something that I want to put in other herbal preparations? How am I going to do it? So one such example would probably be valerian. Now, valerian, like I said, it smells like toe jam. It smells absolutely horrible, and I will not, because I am neurodivergent as well. It means that certain tastes and smells just not gonna cut it for me. But if I put it into a tincture and I shot it, then I eliminate the smell and the taste and a lot of different factors. So when it is that you get to know your herbs, you would know what works best for that herb for you and what it is that you want to do. So like rosemary is a very safe herb, except if you're pregnant because it's abortive. Now, when you get to know about rosemary, a lot of times you can actually help people with just rosemary. It's really good for your brain. So if you're studying and you want a brain boost, rosemary. You don't need to get gotukola and ginkgo and all the other fancy herbs. Rosemary is very good for regeneration. It's really nutrient dense, so it helps with healing. It helps with circulation. It helps with your hair growth, skin repair, everything. Rosemary is such a very versatile herb that you can literally recommend it for everything. It's also very safe, like I said, except for pregnant women. I do not recommend herbs to pregnant women. If it is that somebody do take herbs during their pregnancy, and each pregnancy is different, so what might work for one pregnancy may not work for the other, and things like cinnamon and rosemary tend to be abortive. Now, if it is that you're ready to deliver and you want that baby out, by all means, then you can, some people take the red raspberry leaves, people have okra water, whatever works to get the baby out, because you want cinnamon and cloves and these things work really well to lubricate that vaginal canal, and it pushes the baby out. You don't need to do a lot of work with it. So if that's the case, in that case, you want to take the chance and you want that baby out. You don't really want to go through a lot of labor pains and you don't want to push too much. That is the only time I would recommend any herbs in a pregnancy setting. Even when breastfeeding as well, because I know people have postpartum depression and they have valerian. So I will never recommend herbs that will be passed to the baby via breastfeeding. So if it is that you are not okay with chamomile being passed on to your baby, then I will say don't take it. No, it means then that postpartum depression is going to be a very stressful time. So then you're going to have to use other methods of managing your symptoms of postpartum depression. If it is that you can't use herbs and teas and these kinds of things. So you might have to go for a walk, or you might go outside, or be a little mindful, be away from the baby, because sometimes, your anxiety is like so much. So, you need to have a proper support system. You need to have a spouse who actually, works with you to take care of the baby versus you just doing, baby stuff yourself. So there is a lot of factors that goes into pregnancy and postpartum. And I don't really recommend herbal remedies for it, simply because, like I said, everybody is different and you don't want something to happen. So anything that's good for circulation is also good for prostate health. So if it is somebody who has issues with prostate, circulation is always good for them, simply because the immune system is totally different. So, once you get to know your herbs and you get to know what it does, you can say, okay, well, if somebody has issue with their prostate, how do we get circulation in? You don't need to consider their hormone level unless it's actually treating something that is hormonally affected. For example, some issue with thyroid, and then you get blood tests done. When you see the results, so I am clinically trained. So when I did my studies, so I did phlebotomy, I did traditional Chinese medicine, I did Ayurvedic, and I did vitalist herbalism. So we are clinically trained to take information from clients. And then if it is that they have any blood work, so we can tell them, ask your doctor to request X, Y, and Z blood work. As a herbalist, in Trinidad is not very regulated, so we can't recommend or ask them to do any blood tests. It's going to have to be on the recommendation of your doctor. So you can just tell your doctor, hey, I want to do tests for this. If you want to check for PCOS, if you want to check for insulin resistance, if you want to check your hormone levels, if you want to check your nutrient level. So each different color tube that the phlebotomist take actually goes to different departments. If you want to check your platelets and your white blood cells, that's CBC, that's a purple top. Blood chemistry usually goes into a red top, and you can actually check your mineral and nutrient levels. So when they talk about blood chemistry or biochemistry, they'll actually look to see what those different levels are, if it's elevated or if it's low. So really your blood can tell us a lot about, what is going on. And this is why while I don't do overall and general recommendations for clients, I always try to get as specific as possible, get as much medical record history, dietary intake. All of these things are very important, because if it is that you take certain herbs or you take certain foods, you can actually get toxin buildup, and that can contribute to issues with your liver. So a lot of these things, that's why, knowing your diet and all of these things are important, and it's very mindful on what you consume, because they all play a role into your general health and detriment of your health as well. So while you think that you're being really healthy, you might actually be introducing toxins from, both things overlapping and microdosing on toxin. So this is why I had talked about the materia medica in the first session and the herbal monograph, because you actually get to go in and research the plant, the biochemistry, what part of the plant usually causes allergens. So for example, aloe vera, the latex component of it is usually something people allergic to. So whenever you're making preparations and stuff, you want to work with the gel. You want to make sure it's separated properly. So again, this is why I stress on sterilization and sanitization, because you want to make sure that everything is handled properly before administering anything. Herbal medicine will get a lot of hate from doctors, and there is no standard for herbal medicine, which is why we can't do a test, which is why we can't do a certificate of that is going to be accredited or certified. It's going to just be a certificate of participation.
Can
Mm-hmm.
you share like something that can help naturally for fibroids and cysts?
Right. So fibrosis and cysts are high inflammation, and I can share so basically the document that I have for endometriosis is just a guide on how to reduce inflammation and something called the AIP diet, in which you would eat foods that are low in that does not cause inflammation to build up. Drinking things like water infused with fenugreek, that would help. So I can share that. It is usually linked, to fibroids and cysts and anything, but those usually come about simply because you have high inflammation in your body. So by reducing inflammation, once you start to reduce your inflammation, you would notice that you're not having any of these fibroids and cysts anymore. So yeah.
Miss, excuse. With regards to the information, right? Is there anywhere we can go and get printed material? Because I don't trust Google, because I've noticed for myself that I would have looked up stuff way down maybe 10 years ago. And when I go now, it's edited and it's not the same information that is there. I know, like I said, I into conspiracy theory and all them things. And it's no secret that the big corporations own all media. So
Right.
even Google, there will be limited. They do not want us using these herbs and stuff,
So
better quality.
there
So they
are actual other search engines that you can use outside of Google. Because
have
yes,
Brave.
so that's one way to look. Publications, you can take publications with a grain of salt. So you need to see where the publication's coming from and who is the company. So usually there are scientific websites where you get journals and other papers that can there's usually Google Scholar that will give you it. You can actually read them. And what I would say is look for the overlap in the information. So usually the truth lies in the overlap, and you will see like what's going to help. So like I was doing research for like insulin sensitivity and resistance with regards to diabetes, and how it is that making lifestyle changes can actually or be proactive if you come from a family of diabetes to actually reverse the symptoms. And a lot of the stuff that I learned in traditional Chinese medicine was actually what they recommended in terms of the active ingredients. So for example, berberine is now being put as a superfood, helping with diabetes, take your berberine. But really, berberine comes from things like Karaili and other bitter
Stuff.
foods. Yeah, but the question is, are you willing to eat the bitter foods? Now, if you're like me and I love Karaili, I will eat Karaili, but I might not eat Karaili every single day. So how it is that, but I would take a berberine supplement. So, I wouldn't go for like the very expensive brands or the brands that's trending or the brands that highly advertise, simply because we know what their marketing budget is, and more than likely, I don't want anything with high fillers in it. So usually I tend to do a bit of research about it. It's always good to know somebody who's a pharmacist who can actually help you and advise you. So I do have a friend who's a pharmacist. I bother him a lot with all my questions. So it's always good to know somebody who's a pharmacist that you can and willing to share the information with you. That's the other thing as well.
Okay.
Non-print. Okay, so print material. So here's the thing. Information is dynamic. So things that we would know from some time ago might change. There's the introduction of GMOs. So, seeds and all these growing plants and stuff. All these things, it's always going to change according to what the research is and what the research tells you. So I would like, one of my things that I look for is the overlapping cultural information. So what is the overlap between what we learn as Indo-Caribbean people or African people, and you actually do like some research into your cultures and see like what foods, what things that they hold there, what information that they pass on. It's always good to talk to an older person if it is that you don't really want information from Google, simply because they would have done traditional medicine for years. So somebody might say, okay, well, they've been using turmeric all this time, but just because the doctor told them to use a blood thinner, they decide to use it. But the older folks tend to know what to do to correct it, and they usually correct it earlier on once they start to see signs and symptoms of it.
Miss, another thing I was supposed to ask, are we allowed to bring in seeds to plant from like different herbs and like burdock and all these different things to bring in here?
That's the thing. You can, but you might have to require like a specific license to be able to do that. Simply because seeds, you don't know what parasites and microbes that will come with them, and that is an issue. So more than likely, it's going to have to go through quarantine to make sure that nothing happens, or if they do any screening or any of those things. I know with mature plants, there's a huge screening process, both to leave the country of origin and come in, which is why when you carry seeds abroad, it's very frowned upon and people don't really like it because you don't know what you're carrying, and you don't know what type or the genetic makeup of that plant and seed and how it would react in the environment that it comes in. So for example, like dandelion is a weed, and the plants are disseminated by wind. So it means that it's going to carry the seeds away once that wind passes, and it's going to grow like a weed everywhere. So, you need to know your plant and what
Mugwort is also considered a weed. A lot of the beneficial plants are considered weeds. I don't know if
definitely.
it's by nature or choice.
So somebody asked about traditional Chinese medicine. Okay, so that is a highly gatekept information, to be honest. In Trinidad, this is why you don't see Chinese people in the hospitals, because they have the people that they go to and they have their practices. So for me, I personally work with traditional Chinese medicine on myself, because it worked for me when Ayurveda didn't, in terms of identifying what was wrong with me, looking at the blood test results and the symptoms and all of the side effects and all of the things that I was experiencing. It worked for me personally. So you will not get somebody to treat you with traditional Chinese medicine. You may get some acupuncture in Trinidad, but it's a highly gate-kept practice, simply because the core of it has to do with like your essence, spirituality, your chi. It's not just you take parts of it, you actually have to embrace it holistically. And one part of
It's
it
a
is
lifestyle.
medical astrology. So what we use is that we use your time of birth, your place of birth, what planets will align, because there's the belief in as above, so below. So if it is that you're born under Mars, Mars plants are grown and populated under Mars, the day for Mars, all of these things are important. So before modern medicine, all the doctors used to practice traditional something called medical astrology. Now, in session 1, I actually give the YouTube links to some Q&As about it and talking about it. But basically, the essence of it is that they would use your birth chart to say what days we can do surgery, what things in detriment. So when something is in detriment, so for me, whenever the moon is in Pisces, my ankles get swollen and I can't do anything about it. So I just sit down and do absolutely nothing. Some days I might feel like to do a face mask or a hair mask or something, and I realize the moon is in Aries. So I get these intuitive feelings. I mean, because I was practicing it, like when the moon phases happen and I feel a certain way, I would know, okay, if my planets are in detriment, I would know, hey, take precautions against certain things. So I may not, if it is the moon is in Pisces and I know my feet are going to be swollen, I'm not going to stand up. I'm not going to do anything where I'm standing for very long to promote that my ankles to get more swollen, any of these things. So the same thing used to happen long ago. They used to say, okay, so you can schedule surgeries on certain days because, there's lower risk of you actually being in a planet of detriment and prevent healing and those kinds of things. So now with modern technology, where we don't take into consideration the person's constitution spiritually, and we remove the elements of spirituality from our holistic practice and, our everyday life, what happens is that you get a lot of complications happening when people undergo surgery at any given time, which is why Hindus, once they go to the pandit and they get like a reading for the year or the month or whatever the case is, they follow it very strictly because it helps them to have a better life or a better quality of life, because if the pandit is medically trained, they can actually advise you medically as well. So yeah, that's just the little, gist of it. Now, with regards to learning, so Coursera.org, I'm going to put it in here. They have a course called Everyday Chinese Medicine 1 and 2. It is taught in Chinese, but you can put on the
subtitles.
So you can put on the English subtitles, and then once you complete it, I think you got a quiz and you got a certificate. Now, I'm not sure if it is free anymore. It's called Everyday Chinese Medicine. There's 2 courses, 1 and 2. This is actually really good for practicing yourself, your family, looking at your tongue, your nails. So in Chinese medicine, people don't really wear if you're practicing, you don't really wear like fake nails or nail polish and stuff, because by looking at your nails, you can actually gauge the health of it, the color, if it is actually deficient. They try to be more natural, right? So they will look at the color of your tongue, if it have your scallop edges. So scallop edges mean something to do with your chi, if it's light colored versus if it's brightly colored. If you have markings on your tongue, like if you have that white coating on your tongue, they will look at your hair, your eyes, your skin, if you're healing properly. If you're not healing properly, you're dry. So these are a lot of the things that they actually look at when you go for traditional Chinese medicine. So this will tell you your pulse. I think there's 12 different pulse points to each of your different organ system to actually tell you which of your organ system is good or not. I am not so versed in that one with the pulse taking part, but the course will actually do an overview of it and show you how to do it for yourself. And I think that's a start for traditional Chinese medicine, simply because, like I said, it's gate kept in Trinidad and you will not get information readily. Now, with Ayurvedic practices, there is the Mahatma Gandhi Institute for Cultural Cooperation. They actually do have scholarships to India where you can actually go and do a certificate or a bachelor's or a doctorate in Ayurvedic medicine, and you can actually contact them by their Facebook page for information. It usually works with the India High Commission because we have bilateral relationships with India, so they kind of promote that as well. So if that's something that you want to check out, definitely. Okay, so we have 5 minutes. Any more questions?
Could you repeat with the Indian embassy? Could you?
Okay, so this one
that
is
of information, please.
Gandhi. I sent this in the group chat here on Zoom, right? So they actually do have a building that is by opposite Mount Hope side there, where Lockjack UV Lockjack is somewhere in the back there. They actually have a big building where they have like classes and stuff. But I know the Ayurveda part of it, they actually do have a scholarship to India. They have other, for oral care. What, like your mouth? So like dental care. That's what you're asking. What tips are best for oral care? So cloves is really good for your mouth. Getting in your vitamin C is really good for scurvy and gingivitis and all these kinds of things. Okay, so it really depends on what ethnic group you come from. So this is why I would always recommend people get to know what ethnic group you come from, because your genetics play a huge role in how healthy or how sick you're going to be. So if it is that you're mixed with multiple things and you might be sick and you don't know why, it could be that one of the lesser genes in your system. So for example, there might be something in your African population, but because you're Indian person and you don't know that you have African blood in you, you're not having sick with anything with terms of Indian, you will be like, oh, why am I being sick? It's always good to know what are the issues the African population is predisposed to. So this is also linked to oral care, dental care, simply because people with Arab blood tend to have more they're genetically disposed to cavities and tooth rot and all of these kinds of things. So getting to this is why I studied genetics. That was my fun thing. So what is the thing that I focus on is getting to know what your makeup is, simply because doctors might overlook certain things because of passing. If you Indian passing or if you're African passing, there might be things that you're doing that are detrimental to you and does not promote your good health. Somebody was going to ask a question.
Nobody ready to eat yet.
What you said there just now is so true, Miss, because I have a rare blood disease. Well, everybody know about sickle cell, but
Yeah.
I have a rare type of sickle cell. And because of not knowing my history, for years I was not able to treat it. And it's only when I started learn of what my culture and stuff, then I was able to know, okay, here what you had to use this, you had to use that.
Mm-hmm.
So it's women just said, just for especially we women, we need to learn about our history really, really, really bad, because our health depends on it.
Definitely.
Because you could end up in your later days very ill, very sick, and you don't know why, because mommy didn't have it, brother didn't have it, nobody in that circle had it, but somebody down in the generation that you come from that you didn't know about had it.
Also, this is very important for people who come from like single mother homes where you don't know who your dad is, or there are people who sow seeds and they get families and they forget about the seeds that they sow. This is the most disgusting thing for me, because they keep the children hidden, and then you never know what your genetic makeup is because of that. And I've seen it happen. I have to keep the secret. Because I'm like, you're isolating this child from so much more than just their family, but their genetic history as well. So this is where like people who come from single mother homes especially need to figure out or find out or ask all the questions that they possibly can as well. Okay, so I think the class is going to cut off just now. This is less than a minute, so I will upload all the recordings today at some point between now and say 5 p.m. Any questions you'll have, feel free to message in the group chat. The group chat is where we will be very interactive. I'm sorry, I can't answer the oral health question that has to do with genetics, so I can only give you like an overview of it.